Hello and welcome to this episode of the Health Bridge podcast. I'm your host, Holly B. Today we're talking with Dr. Torkil Faero. He is a GP and emergency physician, documentary filmmaker, author, and photographer. Over a 26-year career as a freelance doctor, he has worked all over Norway, which is where he is from and resides. He's had 100,000 consultations, and that has led him to a really unique picture of the diseases that plague us. He learned that the cause is most often found in the stresses our daily lifestyles place on our bodies. And when his father died at 73, he realized that he had to change his own lifestyle. Being 40 pounds overweight, undertrained, overstressed, underslept, and drinking alcohol daily, he learned that his lifestyle could deprive him of decades. Using wearables, he found a way to track and regulate his nervous system and physiology, and this led him to authoring his recent book, The Pulse Cure, which is what we are here to talk about. Dr. Torkil is an award-winning photographer, author of The Camera Cure, and has made TV films about his pilgrimages to Nidaros and Santiago de Compostela. He's an avid traveler and has visited over 80 countries, and he speaks 8 different languages. Dr. Torkil's book, The Pulse Cure, really spoke to me in that it is something that anyone can really use to gain a really valuable insight into their day-to-day health. It really helps to put some power back into your own hands without having to go to doctor's appointment after doctor's appointment or seek out practitioner after practitioner. Just by wearing a heart rate monitor device, can you gain super valuable and usable insight into your normal daily lifestyle choices and patterns. And you can see how different things affect your autonomic nervous system. So we are going to talk about, first of all, what is the autonomic nervous system? Why do we even need to worry about it? And why we are living in such a different space in these last many decades than we were in the majority of human history, and why we now have to look at different measurements of health in order to survive and thrive. Surviving and thriving 100 years ago to 10,000 years ago looked a lot different than it does today because our stressors are so much different today than they were prior to all of this different modern lifestyles that we have created. So we are going to talk about the number one stressor that he's seen in his research that will tank your heart rate variability. We are going to talk about what this has to do with regulating inflammation in the body, helping gut health, helping your overall immune system, and how it might even be able to help you monitor whether your medications or supplements are helping you or not. Dr. Torkil basically says that what you can measure, you can manage. I think that's such an empowering way to approach your health, whether you are just looking to stay healthy and have longevity in life, or whether you are managing an illness or an acute injury. If we can measure where we're at, then we can manage it better. And we even dive deeper into that as far as why we can't necessarily trust just the way of listening to our body or listening to our intuition on how our autonomic nervous system is on a day-to-day basis. Our body is designed to not give up that information easily in a way that we can track it consciously. So again, this is a powerful conversation, and I want to ask you before we dive into it that you please take just a moment to like and subscribe to this podcast. It helps expand our reach and get this information out further. And any help that you can do in helping us with our mission there is greatly, greatly appreciated. So Thank you for taking a moment to do that. And now let's dive into this conversation. Dr. Torkil Faero, welcome to the Health Bridge podcast. We have a really, really great conversation coming up all about heart rate variability, something that you've been focusing on for quite a while. And you have a new book called The Pulse Cure, which I just finished listening to. And I'm really excited to get into this conversation about it with you.
Thank you, Holly. Nice to be here and been talking about heart rate variability. So I'm looking forward to the conversation.
We'll just dive in by explaining what is heart rate variability for those that don't know. I think it's a term that I've heard before. I hear it tossed around, but I don't know that people really know the details of what it is and what it means and how, like, what does it have to do with our overall quality of life?
Yeah, so heart rate variability is the variation between heartbeats. So the heart does not beat at a very steady pace like a metronome. So it has some variation between the heartbeats. And when we explore HRV, heart rate variability, it's a measurement, among other things, on the autonomic nervous system in our body. And the autonomic nervous system is probably familiar to your audience, I would think. You probably have been talking about it. And it's divided into two parts. It's divided into the parasympathetic part, the rest and digest, the recovery part, and the sympathetic fight, flight, and freeze, where I would also add fun and hunt, because also positive states would also trigger the sympathetic part of the autonomic nervous system. And the good thing is that the heart rate will be different in these two states. So if I am in the parasympathetic state, then when I breathe in, the heart rate will go up a little bit, a little bit faster. And when I breathe out and there's less oxygen in the lungs, then the heart rate will just slow down just a little bit, measured in milliseconds. And on the other hand, if I am in the stress state for whatever reason that we will discuss, whether it's you're eating the wrong food, you have been training too much, you're in the week before menstruation, you have been drinking alcohol, you are mentally stressed, or are at an altitude, or just so many different causes of the sympathetic stressful mode. When you're in that mode, the heart will beat at a very steady pace, regardless of you breathing in or out. So it's like our body is in the survival state, where it will think that we need to use all available forces, even when there's less oxygen in the lungs, just to survive the next moment, right? And then, of course, these new techniques, the new devices, the watches and Oura rings and Whoop bands and everything, they will track the heart rate and will see whether our stress level is sustainable with health over time. And they use, the algorithms based on millions of users. They use artificial intelligence to give you individualized advice on how to train, how to sleep, how to do different things. And so this is a technology that can help us track our health and get more control of our own health. Because the heart rate is just like in our car, you have the speed, you can see on the dashboard. And this is quite in the same way to see the intensity of your life that is revealed in the heart rate. So I think it's really valuable biometric. And it's, in fact, the only biometric that we can use to get this insight into it. And that I think is part of the reason why we in the medical community, I'm a doctor, have overlooked this autonomic nervous system. We have been thinking it's autonomic, so we can't do anything about it anyway, so why care? And we cannot measure it, but now we can. And people can take then control of their stress levels, which probably, is too much stress and too little recovery is one of the main causes of disease in my mind.
I agree with that statement. And especially in the autoimmune community, I see stress as being, in some form, as being one of the biggest triggers for the presentation of autoimmune symptoms coming out, whether that's through an acute trauma, whether that's through long term mini micro traumas, whether that's just being a people pleaser and always putting yourself last. Those are all different types of stress that we put on the body. And we hear practitioners talk about the importance of getting out of fight, flight, or freeze. And sometimes when we're in a hyper state of, fight or flight, we can recognize that, we can feel that. But I think that there are more subtle, like we're just so used to being in a subtle mode of fight, flight, or freeze that we stop being able to recognize it because it just becomes part of normal daily life. How do we start to recognize that? We can use these devices to start to register when we're in rest and digest, when we are in fight or flight, and then we can start associating, okay, well, what got me there? Is that what I'm understanding?
Yeah, that's totally right. Everything you said there. And we're not really equipped from the nature side to be aware of this. It has never been needed until the last, few decades. Earlier, it was just naturally, if nothing happened, you were relaxing. And most of the time, nothing happened. So it has never been needed to have this surveillance over our inner state and stress levels, which is why I could have you cannot feel if you have 60 in heart rate or 80 in heart rate. You wouldn't know. And on the other hand, we can see millions of shades of color. We can detect, some say, 1 trillion different smells, and we have a good sense of touch. Everything that was directed towards the outward threats that has been threatening our existence, for the eons. But now it's our inner stress levels that is killing us and giving us autoimmune diseases and cancer and heart disease and almost everything else of the modern day lifestyle diseases. And these wearables is something just like in your car, you would think you're driving at 60 miles an hour, and suddenly when you get this kind of speed, the detector, the speedometer, you understand that you're running at 110. And when you thought you had been breaking down all the way to standstill or zero, no, you're not. You may be doing like 30 miles an hour, in a physiological sense. So suddenly you get an insight to what goes on under the hood of your body. And that makes it so much easier. So what you can measure, you can manage, right? So I agree that most of the people who get autoimmune diseases, they can tell me as a doctor that has been a stressful time, either just in the period before or all of their life. You know. So it's really important, particularly for the people with problems with autoimmune diseases, to get control of this. It may not, cure the disease, but it can manage the symptoms and to regulate the stress levels. Yeah.
Exactly. It can help you get closer to the remission state, which is always the goal. And I think you basically just answered this, but just to put this in the form of a question, there's so many people that talk about intuitive eating or intuitive lifestyle. And especially with women, we have the cyclical nature and we like to ebb and flow in things and we trust our intuition. But why? But I think you just answered this, but why can't we just listen to our bodies to tell us where we're at?
Yeah.
And why can't we
Yeah.
just trust our blood tests and those sort of things and see
Mhm.
those more other markers come?
Yeah, so absolutely, because as I said, we're not equipped to feel it, the stress levels. We're even equipped the senses are muted towards our own. We don't, the sounds of our heart and the sounds of our breath is down under the frequencies that we can hear. And I don't think that is accidental. So any noise from our inner state would be in the way of the signals from the outer world. That has always been the most important. If you had been, 500,000 years ago, been sitting there being anxious and feeling a lot of stress, you wouldn't notice the predator creeping up towards you, right? So we are terrible at listening to our own body. which is, of course, the reason why so many people end up in a burnout situation, in a fatigue situation. That is so common. It's almost more common than not having it, you know. For a 30-year-old woman or 35, it's almost more common to be tired than not to be tired, in my experience.
Yeah. And I also hear, oh, getting older, everything's blamed on, oh, just getting older. This is normal. Being tired is normal. Hurting is normal. But if we can learn to track things like
Mm.
by using these monitors, then maybe we can realize, oh, well, if I just tweak that and if I, adjust this in my lifestyle, maybe these things aren't actually normal. It's just what I'm used to.
Yeah. And I have done all the mistakes in my own book. So I used to be tired, but that's like 10 years ago. Now I'm not tired anymore. It used to be, I used to be tired every day. I didn't know that it was the alcohol. I didn't know it was the nicotine. I didn't know it was my poor circadian hygiene. I didn't know it was the food I was eating at the wrong time of the day. So all of these things that I'm writing about in the Pulse Cure, when I fix that, I'm no longer tired. Only occasionally, maybe if there's a lot of pressure, but it's not even every week that I would be tired. So once you get to fix your lifestyle, you experience more well-being, more energy, and you minimize the chances of you contracting one of the modern day lifestyle inflammation-based diseases. So, so it has been such a great tool for so many people, which is why the book has been just this wild bestseller in Norway. And in Norway, it has been out for 2.5 years, and it's still so much buzz. It's like having been in a tornado for the last 2.5 years, because I'm normally an unknown person in Norway, and people would not recognize me on the street. I used to be just a normal doctor talking one-on-one with patients, and doing the job that was expected of me, handing out the prescriptions and referring them to the specialists and radiological procedures and all of that. But since the postcure came out, it has just been helping so many people, and they would, tell their friends and their friends again. And this is why it does, actually in Norway, it does all the equivalent of, I think it's 3 million US books, if it was at the same scale in the US. So it's changed my life. So that's certainly.
Well, that's amazing. And I'm happy to help spread the word here in the US. I love and appreciate the fact that you have stepped outside of the standard Western medicine box to things that will actually be proactive for patients rather than just the prescription, just treating causes. There are amazing medical doctors doing amazing work. I'm not disregarding that, but a lot of them just simply don't know these types of tools. They don't know how to use them. They don't know how different lifestyle changes can really, really affect their patient's health on such a deep level. And so I just want to say thank you for that.
Mm.
um,
Yeah, thank you. And the reason is that we were not taught this in medical school. And I had to change my life around. It was 12 years ago now. My father died at 73. And I could just look in the mirror and look at myself, weighing 40 pounds more than I do today, totally undertrained, unexercised. And I could see that if I don't change my lifestyle, I will end up like my patients. I was starting to look like my patients. I could recognize that. And when I needed to change my lifestyle, I hadn't learned that. So I had to do like medical school 2.0 and do it all on my spare time and reading books, getting the knowledge, because we did not learn how to create health in medical school. We learned how to categorize diseases and which medication or procedure belong to the certain disease. And that is what we learned. And so the medical doctors are really not equipped, to create health, and particularly to create or avoid the modern day diseases that I think most people do not know about insulin resistance and inflammation and oxidative stress and mitochondrial dysfunction. They're busy, writing up prescriptions for things that don't really work.
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode. I totally agree. And since you brought it up, let's talk about metabolic health. Can you break that down just for anybody that, again, has heard the term but doesn't totally understand what that means? And then we can talk about the insulin resistance and the inflammation.
Yeah, metabolic health is, I think, all of these different things. It's insulin resistance because you're eating too much carbs, too much fast carbs. We get inflammation because we sleep too little, because we eat food that our immune system and digestional system will not recognize as food. There are many other sources of inflammation. That could be alcohol, it could be food intolerances, and or mitochondrial dysfunction. We're not in a good fitness level. We're not outside. We are not, getting the energy from the sun into our mitochondria. So they're working poorly. The energy, how do you say, the energy resources in our body is compromised. So they're not performing at their best, our mitochondria, which means that all the tissues underperform, the organs underperform, and we as a total organism underperform. And that is the real problem. And once you start following the advice in the pulse cure, which, of course, when I'm talking about the pulse cure, it sounds like it's all about tracking, it's all about the technology and watches and so on. But that's just a small part of it. The pulse cure is really the best, compilation of smart things to do when it comes to sleep, nutrition, exercise, and active rest, stress management, and these things. And it all points to the way we were living, an ancestral living. So the more we live like our ancestors in a very natural way regarding circadian rhythm, food, and exercise and movement and sleep and all these things, the better our heart rate becomes. So when we do something that is good for our body, our heart will show that. When we do something that is bad for our body, the heart will show that as well. When you have inflammation in your system, your heart rate goes up to deal with inflammation. So the new technology really just points backwards in time to a way of living. And of course, we don't have to, you know, go dressed in leather or furs, from the animals and live in caves, but you have to do something that is more similar. You have to be outside. You have to move. You have to sleep at the right time and so. So when you do that, and the problem with this is that it's free. All of the advice in the Pulse Cure does not cost anything. It could even be cheaper. Fasting is cheaper. Water is cheaper than anything else, right? It's free to meditate. It's free to do breath work. It's free to walk, being under the sun, of course, is free. And that the problem is that there's no commercial pressure behind it. So it's not possible to monetize on this. And in our commercial world, that is not necessarily a good thing for people. And there's too much money in sick people. That's obvious. So it's just like follow the money. It's probably a part, and subconscious thing or unconscious thing, but I think it's also very conscious. The food industry makes us sick, the pharmaceutical industry, picks up after that, and it's my opinion anyway.
It's my opinion as well. And to hear the same opinion coming from a medical doctor that is in that world as well is refreshing. It's the message that I've been trying to get out as well. And you're right, these things are free, but we have to learn what they are, right? And so getting your book is a great guide in that. It's also a lot of what you talk about in your book is what I work on in my coaching program as well. It's getting back to, the more ancestral patterns because, well, I just did a post about this on Instagram yesterday about how we are not as evolved as we think we are, right? Just because our mental capacities have gotten to the point where we can create this incredible technology like a heart rate variability monitor, it doesn't mean that our bodies and our mitochondria and our cells have been able to shift and change and adjust to this in that short period of time that we've been living this way. And so it's really unreasonable for us to expect that our bodies can thrive in these unnatural environments.
Mm. Yeah, I think we doctors or the whole medical community have not understood really the basic physiological systems in our body. We haven't understood the sun. We haven't understood water. We haven't understood, the effect of movement. But I think now that we're getting down into the kind of from the micro level to the nano level in our bodies, we understand more of the really basic processes. So we're starting to get, so it's not only, this is also possible to see measured in the physiology, in the biology. So it's not just thoughts or philosophy, it's science. Yeah.
So question about how the heart rate variability monitors work when it comes to nutrition, because that's one big thing that you touched on in the book is how we can use the monitors to help us determine what foods are helping us basically and what foods are hurting us or keeping us in that inflammatory level, keeping us from sleeping well, etc. And while I was listening to the book, I was drawing comparisons to continuous glucose monitors. And I'm curious in your research if you found that using a heart rate variability monitor instead of a continuous glucose monitor, if you can still get some of that same information by using the heart rate
Yeah,
monitor.
I mean, you could, and I've been using a CGM quite often as well, and I can see that for some foods that spikes my blood sugar can also spike my stress levels, but not necessarily. So it seems to be more the kind of hyperpalatable food, the ultra processed food, sweets, candy, that kind of thing, chocolate and so on, that can really, really spike the heart rate as well as the blood sugar. But sometimes if you just eat something natural with sugar, it's not necessarily the sugar in itself that creates the stress. So it's not a one-on-one relationship really. But what you will see, and I think most people will see that they will react to certain foods, and because the heart rate will go up. For me, it's gluten and milk and chili and different sausages. It can be different foodstuffs that I can see really triggers my heart rate. And it can stay high for hours. And if I eat late, it will stay, almost all night long. And that is because it creates inflammation in the gut. It creates leaky gut. It creates an immune response. Because the problem is that if we have a poor functioning intestines, then there will be, stuff going into our blood that the immune system, 70% of the immune system is organized around the gastrointestinal tract. And it will just react to these certain foodstuffs and create an inflammation in your body. And after that, I would feel tired. And when you can see that measured and that would be on your Garmin watches. When I'm talking about micromanaging stress levels and seeing like instantly what happens to you, that is the Garmin system and not the other ones. And then I would see, for example, I would have a lunch and I would have two big cakes instead of a salad. Then I would see that my stress level would be high maybe for 4 or 5 hours. Even doing the same job that I did the day before with a salad, had no problem. And that was a really big surprise to me. I had never thought about that. And I would never have been thinking about waking up in the morning and even considering that the state I felt had anything to do with what I was eating 12 hours earlier, which is if I was having like sausages or something with chili, would really devastate my night and leave me really tired in the morning. But when you see the results on your heart rate monitor, then it becomes very obvious. And then you learn how to find certain foodstuffs. But many people that have had problems for many years, fatigue problems, for example, joint pains, those kind of things, they often find that they will react to a lot of different, they will have many food intolerances. So when they do a test, a food intolerance test, they will have a huge list of different foodstuffs. And it's not necessarily all the foodstuffs that are the origin of the problem. They could just kind of go into the bloodstream, they're not the real culprit. That could be something else. But it can be really complicated for many people to find what is actually causing the inflammation. And then I would always recommend the food intolerance test. And I've almost not met anyone that has not seen a huge list of different intolerances.
So when you're saying food intolerance test, you mean gut testing?
Yeah, like IgG test. So
Mhm.
many people do not really believe in them, but in my experience, the ones that has then changed their diet, they have seen the difference in the heart rate variability. So that is for me a confirmation that it was right. The inflammation has gotten down when they see that the HRV will be improved.
So when they do the gut testing, they're seeing what foods are registering as something inflammatory or disruptive for them. They're removing those from their diet, and then they're seeing a positive reflection in the HRV monitors.
That's right. And they feel it. Symptoms
Mhm.
that they may have had for like 20, 30 years just go away.
Okay. And so just to keep going on the nutrition route, what about tracking fasting? Does the heart rate variability monitor aid in that?
Mhm. Yeah. And the first times I would expect to see stress because it felt uncomfortable. When you're fasting, you feel hungry, you feel a little bit, on the edge. And then I was expecting when I saw the heart rate monitor to see stress, but it was all calm. So for so many people, you can see that when you are fasting, that's a relief for your autonomic nervous system, for your body. So digesting food is a stress for your body anyway. And in a natural, even the best of food, will create a certain inflammation, which is totally natural. So it's just the amount of stress that could be too much, when you eat the wrong kind of foods. And then if you're fasting, very many people find that they go into the parasympathetic mode the whole day, 24 hours. And then maybe after 2 or 3 days, their stress levels goes up, that may be. And I usually see that if somebody has a lot of food intolerances, they have a low level, a good heart rate variability when they're fasting. And once they're eating, anything, then the HRV will drop down, the heart rate will go up. So if there's a huge difference between when you're fasting, for example, in a time restricted eating, then it's kind of suspicious that there is a food intolerance that is causing the stress.
And so let's talk about other things too that the heart rate variability monitor can help you make informed decisions on and informed choices. So we've talked about nutrition, talk about sleep. So I know that's a really
Yeah.
big point
So
covered in your book.
yeah, yeah. So this getting your sleep in order is probably the first priority. And the good thing is when you get the sleep in order, then you get more energy to do the other things that may require more effort to succeed. But to get good sleep, that is easier for most people. And then you would see that because most of these heart rate monitors are quite good at detecting sleep. Not necessarily the sleep phases, but they would detect the rate of recovery while you're sleeping, or that you are in the parasympathetic mode as you are asleep. So they would be able to track that, and then you would be able to improve your sleep. And that would be by dimming the lights in the evening. It would be by pushing your last meal maybe to 3 or 4 hours before you go to bed. It would be having your bedroom really dark and cool. It would be to have a good sleep consistency, so that you go to bed and wake up at more or less the same time every day, or as much as you're practically possible for you. Those kind of things. And to avoid alcohol. Alcohol is the worst stressor of all. So according to Whoop, I have a Whoop band on my right wrist here. Alcohol is the worst stressor of all, more than disease even. So I think for most people, minimizing alcohol is maybe the second most important thing, or maybe even the most important thing. And I don't think I've met anyone tracking their heart rate that has not cut down on their alcohol consumption when they see the physiological price of alcohol.
I come from the restaurant industry,
And,
and I see so many people just indulging, and it looks so fun, but I know for myself that I just don't tolerate it. I don't tolerate it at all. It ruins me. It could ruin me for a couple days,
um,
you know? So
yeah,
that
yeah,
makes
yeah,
it very
and before I started tracking this, it wouldn't even cross my mind that a late night meal with a glass of alcohol would, if anything, it would help me sleep. I wouldn't have even been thinking about it. And just when I started tracking this and just realized quite quickly that food has a lot of influence on the stress levels, I wrote a mail to some friends that are nutritionists, asking, what's this? Why does food affect heart rate variability? Why does my stress levels, go up just from food? But they were not interested. They hadn't heard about it, and they didn't care, and they just kind of thought they just kind of told me between the lines just to keep your stethoscope. Don't mess with the food. That's our department. So, but it's very clear that food creates inflammation, and that it's possible to track it.
What about, can it help determine, like in the holistic health world, there's supplement bottles after supplement bottles. If you have an autoimmune condition or something like that, you're probably on multiple medications. Can tracking our heart rate variability help us determine at all how supplements or medications might be affecting
Mhm.
us?
Mhm. Yeah, it can. And what is quite obvious is that if you have a deficiency and you need the supplement, then it's quite obvious that you would see a B12 deficiency. When you get that corrected, you would see it in the heart rate variability, and the same with vitamin D if there's a deficiency, and with iron deficiency. That is what I hear a lot. Get a lot of information that when they correct that, they see that the heart rate variability goes up. And on the other hand, a lot of medications will have side effects that will stress the body. And funny enough, many of those will be for mental things. They could be medications for anxiety or depression that would have side effects that will lower the heart rate variability and create stress. So I don't remember the generic names of many of them, but you would be able to see it. And many people see that when they forget their medications for a weekend on a holiday, and then they see, wow, oh, my heart rate variability went up. And that makes it possible to make a more informed choice on the pros and cons of that medicine. So because the the side effect may be below the level where you feel it clearly, that you have, palpitations, or, a dry mouth, or something that you clearly see as the cause in this new medication. So, but the heart rate will reveal it. So the heart rate, even if your heart rate goes up 10 beats, that will reveal that there's some physiological load on your system. You may not necessarily feel it at the conscious level. So, but of course, over time, even a raised heart rate of 3 or 4 beats, every day, every year, will amount to something. And tracking it this way will make it easier, I think, for the doctor. Of course, the doctors, they would probably not even care about it, but at least for you as a patient, you would understand it more. And maybe if you have a holistic doctor, they would understand that, okay, maybe we should either reduce the dose or find a similar medication that will not have this side effect. There may be alternatives. And for the women also in the menopause age, they would then be able to see that, okay, these hormone replacement treatment really helps me. The heart rate variability improves when I do this, and not the other one, for example. So that's important. And maybe we haven't talked about that, but menstruation, the menstrual cycle, is also super important. For many women that is troubled by PMS, you can see the really huge dip in the heart rate variability for the week before menstruation. And it lasts a whole week. And it's the largest dip in HRV that I see. It's just as large as if you have a strong COVID infection, or if you go, for a 1 week spring break, somewhere, and just drink alcohol the whole time. It's that big. And once you start seeing that, and you start mitigating the stress for that week, you skip the high intensity training, you skip the alcohol, you skip the comfort foods that is not really helping you, and do breath work and cold exposures and other things instead, then you can minimize the stress, and you will see it in the heart rate variability that the curve flattens out for that week. So that's really important. And
See,
heart rate variability is coupled to endometriosis, to polycystic ovarian syndrome, it's coupled to infertility, it's coupled to tendency of spontaneous abortions, and also, of course, of the cancers in the reproductive tract.
that's amazing. I feel like I need to spread the word on this just to women, just for this alone. Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied, will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So, if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
Yeah, yeah.
Um,
So so that is why women of that age, it's the biggest, the users of these trackers to help them to find the balance.
that makes so much sense.
Mm.
I'm curious, kind of along those lines, and I think you referenced this in the book. You had just mentioned COVID. You said that you noticed a change in your heart rate variability in the days leading up to your symptoms coming on from COVID, but you didn't feel any noticeable symptoms yet. And so,
Yeah, yeah. So your body is usually working on it before you get the symptoms, because the symptoms you will get from the immune reaction. And often you can see in the heart rate Like actually, funny enough, this morning, because now I have a sore throat, right? And this morning, my numbers were fine, but the Oura Ring said that their symptom detector had detected something that I should be noted about. That there's something here that my HRV was good, and my sleep was good, but it had seen something that I don't know, but it turned out to be true. So during the course of the day, I got this cool voice, you know, and but it's just a common cold. And you can also then see the difference in the common cold and the COVID infection and the flu. You can see the degree that this is really taking a toll on your system, including surgery, including other kind of procedures that you can then see how the body is stressed by, repairing it. And you can see that how long that lasts, and it usually lasts a lot longer than you would think.
And what I'm also wondering too is if this would help in predicting when a flare, for example, is coming on for somebody with lupus or other autoimmune conditions. They'd probably be able to see it ahead of time before they feel it.
Mm. Yeah, probably. And if you or some of your listeners, you can put that into ChatGPT. You can ask ChatGPT, how about my lupus? Is that has any correlation with heart rate variability? And you would probably get some answers to that. So I haven't been investigating exactly that, but I'm sure there would be some kind of a connection.
Well, I have a new rabbit hole to go down now, so thank you.
Okay.
What about exercise? Because I know you brought up movement being very important in getting back to some of those ancestral truths. How do we, there's
Mm.
so many different exercise gurus out there. Some say you got to do 75 hard. Some's like, no, walking is
Mm.
fine. So we get confused.
Yeah,
It's like the multitude of
yeah,
diets out there, right? How do we use heart rate
yeah.
variability in that?
Yeah, I think if you most of the trackers, at least the Garmin one, they will give you the VO2 max level. And the VO2 max level is a sign of how your metabolism works, how your body uses oxygen. It's a number that will tell you about the state of your mitochondria. And many people, if you haven't been exercising, you would probably see a number close to 30, which is quite poor fitness level. And then you would have to start very easy, because almost any running or any hard exercise will give you so much inflammation in your body that you will feel sick. You will feel like you have the flu, and you will be demotivated and just stop it, right? And so I think it's really important to know your VO2 max, to understand how hard can you exercise. And luckily enough, for health reasons, you don't have to do it very intensively. You maybe in the start just do walking and just running partly, or just easy jogging. It could be enough. And it seems like actually like most of the benefits is all only from being outside. So just being outside for an hour is almost as good as being outside of an hour walking or running. You get like 70-80% of the benefits just from being outside, of course, because of the sun. And but of course, walking in addition to that or running is good, but you don't really need, for health reasons, to push yourself very hard. You get most of the benefits by doing regular activity. And when we put these trackers on hunter-gatherers, we can see that they are in a light to moderate movement 2 to 3 hours a day, and intense movement only for minutes. And the rest of the day, they relax. So that is the intensity that we are physiologically made for, constructed for. So usually most people are overtaxing their systems. They are running our organisms harder than they are constructed for, which will then mean that they will get sick. So And of course, this is in these wearables. They use these algorithms to see that, okay, you are too stressed. And that is important because most people then, of course, when they start using these trackers, they will see that their stress level is way out of whack. It's just really too much. It's just like suddenly getting a dashboard in your car that you have never had it, and suddenly you get a dashboard in your car, and so you see that the speedometer shows that you're running at 120 miles an hour while you were thinking you were doing 80 or 70 or something. So for most people, that's quite a shock, and they get frustrated because it will take some time to be able to regulate this. It's not done like in a week or two. It may take you half a year, it may take you a year to get such an overloaded system back into balance. But it will not help, like many people then say, okay, I'm just getting even more stressed by that. But of course, it will not help just to take the watch or the ring or the band away. The problem will still be there. It's just that you have suddenly seen that you are driving too fast and will get problems from it. So it's just kind of a reality check of the state of your system.
And it's an invitation too that this is for the long haul, right? So we don't need to do everything and figure it out overnight. It's a simple one step at a time. Maybe let's
Yeah,
start
that's
with
right.
nutrition, and or maybe we don't even take things out of our diet yet. Maybe we're just looking at the time of day that we're eating
Mm.
and adjusting for better sleep. We could just pick one of these aspects that we've talked about today and start there and just slowly experiment. So that's how we're going to figure it out, is by slowly experimenting.
Yeah, because most people have ended up in that situation by small steps in the wrong direction for maybe 10, 15, 20 years. And it's not corrected in an instant. Even though we all want quick fixes, so this is not necessarily a quick fix. Or many people, just by quitting alcohol or quitting nicotine if they use it, or quitting certain foodstuffs, will quite fast, be getting better. But for many people, it's a really long process.
What is, as we come to a close here, what's the most interesting insight or thing that you learned either about yourself or just in the overall research once you really dove into this
Mhm.
topic?
Yeah, that one of the funny things in my life has been that when I work at the ER, that is when I'm at the calmest. So I can do like 15-hour shifts, busy shifts is no problem. I'm as calm as can be. And that was a surprise because I was thinking earlier just by default that being at the ER is stressful, and it's not. So that made me, then I can understand that I can do work. I can put on more works and shifts, and it's not really a problem stress-wise. It's okay, it takes time, but it does not really take effort for me. So that was a big surprise. So I know that I can stress and then go to the ER and then I can relax. So often more relaxed at the ER than sleeping at night. And of course, for many people that often think that, okay, work is work, you can see how much your work stresses you. So many people will see that, okay, there are busy nurses. That is quite hard. They are running around all the time. They have a high stress levels. Teachers, so many professions will see that their job is actually quite stressful, and they need to find a way to regulate the stress levels at work, to see how to take small breaks, maybe go out. I heard your podcast was a nice, you take a light break. You go out into the light or light pulse. I don't remember the words you used.
Mhm.
But to go out into the sunshine, to take a small break to relax, because often it's easier to keep the speed up. So you feel tired, and it's almost easier to speed up than to slow down, because then you get too tired when you slow down. So so you will be able to see where the problem is. So what these trackers, and then I'm again mainly talking about Garmin, it's an insight into your energy budget. You see where you're losing energy, and you see where you're gaining energy, and you have more tools to be able to balance this out. And the problem is that if you don't do that over time, you will get sick. Uh, your kind of your immune system, your physiology is not constructed for this kind of strain. And you may have tolerated it in your 20s or 30s. Once you get older and the energy productions in your body goes down, your body's not as forgiving. So I often say that until you're 40 or 45, your body takes care of you, but after that, you have to take care of your body. There's no other way. Or there will be a price to pay. Either you do a small calculated effort to stay healthy, or you get sick and then it's out of your hands. You don't even know if the disease you contract will be curable or have some treatment. And the control is in your doctor's hands instead of your own hands. And these devices and the pulse cure is a way to get the control into your own hands, really.
And I'm all about the whole point of me doing these podcasts is to show people that there are so many different ways that you can take control back, or you can take autonomy in your own health journey. And this is just another perfect example of how we can do that, and how we're not just leaving our fate into somebody else's hands by them saying, well, this is going to work for you, or this is not going to work for you. We can use that information, but we can use our heart rate variability monitor or any other, type of modality that can help us actually make those decisions for ourselves.
Exactly.
You mentioned the Garmin watch. Is that the one that you would say is the best starter monitor to get, or is there other ones that you recommend?
Yeah, it's the best starter, and it's also the cheapest one, the cheapest choice. You will get them probably from $200 to $250, a good enough one. And you would also have if you don't really want to have a watch, somebody really don't want that, then you can have an Aura ring, or you can have a Whoop band. So those are, I think, are my three favorites. But there are, a lot of different devices. But I've tried many. I've tried probably 15 or 20, and I keep coming back to these ones. And by far Garmin seems to be the best choice. But Whoop, they're quite good at artificial intelligence, giving you personalized advice. So for many people, that would be a good choice.
And Dr. Torkil, where can everybody find you and learn more about you and your book?
Yeah, the book is available on Amazon, both as an audiobook that you listen to, and as an ebook and a regular paperback. And I can be reached at Instagram. I'm Dr. Torkil, dr.torkil. But that's also often a Norwegian one. But I'm building up an English speaking one that is doc_Torkil, that I can also be reached. And I'm on LinkedIn, and I'm on lots of podcasts also.
Perfect. I'll make sure to put those links in the show notes for everyone.
And they can also go to thepulsecure.com, where we're building up a site where there's also a video lecture where you can see how I use the Garmin watch. Yeah.
And actually, on that website, is there also a membership?
Yeah, we're trying to build that. We have a huge membership system in Norway, and we're trying to build that up internationally as well. So it's probably possible to be on the mailing list or something when we are opening. Yeah.
Awesome. I think that's such a great resource. Dr. Torkil, thank you so much for coming on and sharing all this information for the listeners today. Thank you so much.
Thank you, Holly, for having me here. Thank you.
Like so many of the conversations that I've had with all the different experts that I've had on this program in the past, this conversation again gets down to the basics of ancestral truths, the basics of how our bodies were actually designed to live and to thrive. And as he said, as Dr. Torkil said, it's things that are free. It's being in the sunlight, it's being outside, it's having movement during the day, it's having rest, it's following the sun and moon cycles to optimize your wake and sleep patterns. It's learning to use breath work or meditation to calm your nervous system down. It's about mitochondrial health. Everything comes down to mitochondrial health and regulating inflammatory responses and keeping the autonomic nervous system out of fight or flight unless we actually need to utilize those functions. But we have created this modern society which regularly is triggering our autonomic nervous system into action on daily, weekly basis to where we think that it is our normal state and it's nothing to worry about. We're used to it. But I always say that just because something is common doesn't mean it's normal. So just because it's a common feeling for you or a common response for you, that doesn't mean that it is normal and we should brush it aside as no big deal. So I'm really excited to get a Garmin watch myself. I am going to invest in that soon, and I'm really curious to see how it tracks fatigue levels or potential flares in my lupus symptoms, which I have generally under very good control. But how can I get it even better under control by monitoring some of these things? What things are actually causing my body stress? As we know, stress is such a big trigger. What things that I'm not tracking are actually causing more stress on my body that might cause a fatigue flare up, etc. So I'm super curious if any of you have been using one of these tracking devices. And if so, I would love to hear your experience. So reach out to me on Instagram at I am Holly Beck. Send me a message and let me know your experience. Or if you are on a platform listening to this, such as YouTube, where you can leave a comment, I would love for you to leave in the comments for myself and Dr. Torkil to hear what your experience has been and what you have learned. Thank you so much for listening. I hope that this was a very valuable conversation. If you want to dive more into this topic of getting back to the simplicity of ancestral truths and how you can work that into modern life, this is what I coach on in my Health Bridge coaching program. I would love to get to know you a little bit more and what your health journey has looked like. So there is a link to chat in the show notes. Get on my calendar. I would love to just have a quick 10-minute chat with you, see where you're at, to see what your health goals are. So make sure you click on that, pick a day and time that works best for you. And I look forward to meeting you and getting to know you a little bit more. Thank you again for listening to this episode. And I look forward to having you back with us again on the next episode of the Health Bridge podcast.